Well, good evening, RDT family and our community family. We're so excited about tonight. I'm telling you right now, I've been thinking about this session all day long, and I'm so grateful that we have the opportunity to just talk about some very important information tonight. I really want to talk to you when it relates to COVID-19, the devastation that it has done to many communities and our world. We've lost a lot of people, and there are many lives that are yet being lost. And so I think that the church need to talk about what's going on when it relates to being vaccinated and people are on the fence. And so tonight I have a very special guest that's going to come with us tonight, and tonight is this session is going to be entitled "Ask the Doctor." So many times we as preachers, we think we have all of the information, and I think the biggest mistake that we can make is, trying to talk about health issues or mental issues, and you don't have all of the information, and you're trying to liberate people's lives by things that you have not been educated on. So I've asked a great doctor to come in and just talk with us on tonight to help us better understand vaccinations. Now, the reason why I did this is because a couple of weeks ago, I was talking to our leadership team. We've been having in gatherings, and many of you're not ready to come back because you're still concerned. And you should be. You have every right to be. You need to protect yourself. You got to look out for you. And so, as I was talking to many of our leaders, I understood that some people were saying, yes, I'm excited about the vaccination. I'm getting mine. And then there were yet a group that was saying, I'm not ready for it. I'm not going to do this right now. I don't know why people are doing this. This is not a good thing. And so I understand that whenever there is two different opinions, that means that we lack information. We lack information. And as your pastor, my goal is to make sure you are properly informed. All right. The Bible tells us that my people are destroyed for the lack of knowledge. You hear that? We are destroyed because of something we don't know. And whenever there is two opinions, that means that somebody may be right or somebody may be wrong. And we need to do our very best to make sure we get the right information. And so tonight, during that particular time, I was praying, Lord, how do I get people the right information? What decisions should we be making at this particular time? And I knew that I have to have a doctor in place to talk about and discuss matters that I do not understand. And the person that came to my mind was one of our very own, a woman of God that have served with us in ministry and done so many great things. Her and her family, they moved to Jacksonville, and she's a great physician, a great doctor. And I value her opinion. I value the information that she has given, her time being with us and even now. And I just felt that if we was going to get information, this is the person that, as your pastor, I trust. I know that she's a woman of God. I know that she's saved, and I know that she tells the truth. All right. And she will not misinform us. So I asked our team to reach out to Dr. Kelli Wells, and she consented to being a part of this session on tonight to help inform us. And so, again, this session is Ask the Doctor. And tonight, I'm giving you an opportunity that if you have questions, you can go to chat and put your question in, and we're going to address your questions on tonight to make sure you are properly informed to the best of our ability. So I want you to give some likes and put your hand together and give a shout out for Dr. Kelli Wells. Can you say praise the Lord for her? Put some shout outs for her. Give her a good DT welcome. Amen. We're so excited about having you, Dr. Wells, and thank you so very much for accepting our invitation to come and be a part of this session. And so, Dr. Wells, listen, I'm going to give you a chance to say whatever you have to say, but there are a lot of questions that people have. There are questions that I have, and I just want to present it to you tonight. Before we get started with the questions, again, I want you to just You can say whatever you want to say to the church family. They haven't heard you for a while, and I know many of them. They're so glad to see you on tonight. So go ahead and give a shout out to the DT family if you don't mind. Say hi to the family, hi to the community, because you're right. You're from Pensacola. Matter of fact, you graduated from Pensacola, Florida, and so we're excited. So give a shout out to your community and your church family if you don't mind before we start the questions.
Listen, there is nobody like my bishop, nobody. Thank you so much for the opportunity. When the team reached out, I didn't ask many questions. The answer is yes. Whatever is needed, yes, I will do it. I will be there. You are my family, and that community in particular. My parents are still there. My brother is there. My nephew. I graduated from Escambia. This is my home, and you all are a part of that. So I'm thrilled to be here. I'm going to tell you, after having a career in public health and then moving over to work at Florida Blue a couple of years ago, where I am leading from a clinical perspective, leading our COVID response for all of our members who have Florida Blue insurance around the state. There is no other conversation that needs to be had in this moment other than what can we do as a community to protect ourselves and begin to recover from the impact that COVID-19 has had on our communities. And there is no way that I would miss an opportunity to do the things that are in my power to ensure that you all have the information that you need so that you can make an informed decision that's based on fact. That was my job and my primary goal as a family physician, taking care of patients. And it has always been the responsibility that I felt for both members of my family and my extended family, including the members of my church family. So I'm thrilled to have the conversation tonight. I hope that, by the end of our discussion, you'll have more information, you'll have clarity on some things, and you'll feel pointed in a direction that is going to, hopefully keep you and your family members safe. So thrilled to be here. Hi, everybody.
Wonderful. Thank you so much, Dr. Wells. Listen here, I'm just going to kick it off because I have not asked you the answers to any of the questions that's coming on. I wanted to just get the information as the people are getting the information. So I have not talked to Dr. Wells about these particular questions and the answers that she would give for these particular questions. And so I'm just like you. I don't know what the answer is. All right, so I want to start off just by asking Dr. Wells, because there are some concerns, and I value your opinion, and I think that you're the right person to be here tonight to share this information. Now, there are people that are on the fence. There are some people that are saying, I'm gonna get the vaccine. I'm going to do this because I feel this is the right thing to do. And then we have a group of people, they just don't feel comfortable right now in doing so. Okay. Maybe they don't have the right information, or maybe some that are doing it don't have the right information. Your professional opinion and the information that you have, let us know what you feel we should be doing right now. Should we take the vaccine? Should we not? And then tell us why, if you don't mind.
Yeah. So I think let me start this way. It is our community that is overrepresented in terms of severe impacts of this disease. It's us that are twice, 3 times more likely to be hospitalized if infected with COVID-19. It's us that are more likely to have the chronic conditions that put you at greater risk. It's Black folks that are more likely to have high blood pressure and diabetes that's not well controlled, and some lung conditions and sickle cell, right? So we come to this point at greater risk of having COVID impact us. More than 70% of Black people report knowing somebody who has died or had severe illness related to COVID. My parents have they lost a dear friend, a lifelong friend that, my girlfriend's mom, lost to this infection. And this is our opportunity. What I've been saying, hashtag, this is our shot. This is our opportunity to recover. And knowing that this day was coming, we get to the point where there would be wide distribution of vaccine, it would be available to most of the population. I started looking at this months and months and months ago. Because I knew that there would be folks who were on all sides of the fence, right? There'll be those who just don't trust the health system. They've had bad experiences, been discriminated against. They know the history, whatever brings you to that mistrust, right? There are those who don't trust the government, and you hear that something is funded or produced by the government, then you're automatically kind of suspicious. There are those who are worried that how in the world can they make a whole vaccine in this short period of time? Isn't that supposed to take years? Like, how are we here? So I knew that this day was coming, and so I started to gather information and think through things. And as a physician, I'm never the first person on the bandwagon. Like, I'm never prescribing that new drug, that thing that first hits the market. That's never been me, because I take my responsibility of educating my patients very seriously. So before I'm on the bandwagon, I'm reading the studies, I'm looking around, I'm asking questions, I'm turning around upside down and backwards, so that when you have a question, I can answer it, number one. And number two, if it doesn't, if you have a side effect or some sort of impact, I'm prepared, and I can counsel you. I can prepare you for that if that's going to happen. And I think, however folks show up in this moment, I can tell you, based on what I've seen in terms of the impact of COVID, that as many of us that are eligible and able to be vaccinated should be, because there is the virus itself. One of the things that viruses do is they mutate, they change, and we're starting to now see these new strains of the virus emerge. And I'm worried that the few treatments that we have that work to kind of help prevent death related to COVID are going to be less effective as the virus gets smarter. And so what we have to do now is step up and stop the spread of disease in our communities, so that these mutated strains can stop developing and we can decrease our risk. And let me say this at the top of our discussion: my parents are 81, and both of them have been vaccinated.
Wow. Well, thank you so very much. That is so important to me. I'm hoping that we would get this information. There's another question that I have, Dr. Wells. When it relates to clinical research, has enough people in the Black community been tested to give us good data? That's been a concern in our community.
Yeah.
A lot of Black people, we just don't like that testing thing, and so, but have enough people in our community been tested to give us the right data to motivate us to be vaccinated?
Right. So short answer, yes. And I can tell you that, again, this is one of those concerns we get to from, a really legitimate place. Nobody wants to feel, like they're being experimented on. And we have a history of having that happen. Right. I've got family in Tuskegee and grew up hearing about the atrocities that happened in the Tuskegee experiments. And those aren't the only places, right? This is what we've heard about, right? I think that our system has failed us, the health system. And then physicians have kind of consistently underexplained things, either because they didn't want to take the time or, what have you. And so, being left in the dark, and the information that you have access to suggests that you can't trust the folks that are supposed to be leading the clinical response to this. Of course, we're going to get to this place. I will tell you that I have personal knowledge of the fact that these clinical research trials worked extremely hard to recruit and to keep Black patients and other patients of color in these studies, because I think it was clear to them that our being represented in the study was going to be a critical piece to this. And that happened here in the Jacksonville area, where I know that primary physicians, Black primary physicians, were being asked to participate in the study as investigators so that their patients would enroll, right? And so I know that was occurring. I also know that the minority physicians organization that I trust, the National Medical Association, actually put together an independent panel. And it had physicians and pharmacists and public health experts and researchers were part of this task force that they put together to look at the data, all of the information that Pfizer and Moderna were submitting to the FDA. This independent review council that was set up by the Minority Medical Association looked at that data themselves, because they wanted to be able to, from an independent perspective, say yay or nay to whether or not they agreed or validated the information that was being put forth. And they came out with a number of thoughts and recommendations. But one of the first things that they stated, the National Medical Association, is yes, there was enough representation of minorities in this in these clinical trials for us to accept these results as valid. The other thing that happened is that when the two companies presented their data to the FDA, the FDA, Food and Drug Administration, has an independent review body. Like, they have, again, a set of researchers that and clinicians that look at all the data, and then they come together to decide, are we going to, allow emergency authorization of this or not? Those hearings, those reviews are open to the public, and I have physician colleagues who watched that. And so watch the discussion and watch the things go back and forth. So, there are a lot of things that happen behind closed doors, right? Really in any area. In this case, I think, knowing there would be questions, knowing there would be those who would have concern, minority organizations like the National Medical Association really tried to prepare in advance to be sure that they could have a position or an opinion about this that we could trust. And so I do feel that the representation in terms of the research was what it should have been. But now I think, we'll do this with I'm sure the rest of the questions, but then we need to kind of dig through, what are the other kind of specific things that we should be aware of or that we should be concerned about with the vaccines.
Listen, I do want to remind people that we are accepting questions in chat, and so you can definitely put your question out there, and we would try to address it. We want you to make sure that you're getting all the information you can. Again, people are destroyed for the lack of knowledge. So this is the night that we get a chance to ask the doctor. Dr. Kelli, you have Moderna out there, you have Pfizer, and then we have Johnson & Johnson out there. Should we desire one over the other? Do you recommend one? I know a lot of people are saying, man, I just want to get the one shot, and be finished with it. So let me get Johnson & Johnson. But what, just give us some conversation of what your recommendation would be on this.
Sure. So let me first say that the effectiveness of each of these three available vaccines actually is quite high, and it really exceeds the effectiveness of some of the vaccines that we kind of talk about and think about on a regular basis. For instance, with flu vaccine, we tend to get 60% or sometimes 70% effectiveness at preventing severe illness with flu, and we think that's great. That means 7 out of 10 people who get a flu shot won't be in the hospital with pneumonia if they get the flu, right? That's kind of the desired outcome. When you talk about Pfizer, Moderna, you're looking at an effectiveness of 90 to 95% at preventing moderate to severe illness, right? Remember I said it's worse for us than it is for for members of other communities, right? So we're more likely to be in the hospital. We're more likely to be on the ventilator. So it is Black people who are more likely to have that moderate to severe illness, and that is exactly what the two vaccines, Pfizer and Moderna, are 90 and 95% effective at preventing. Okay, the Johnson & Johnson vaccine, which is just one dose, its efficacy or its effectiveness is a little bit lower. So where we see 90, 95% with Pfizer and Moderna, with Johnson & Johnson, it was just over 80% in the U.S. at preventing moderate to severe illness, right? In both of those sets of studies, no one died. So it was actually 100% effective at preventing death, which doesn't get enough notice. I think that is a really key parameter. My parents, they are the most important people in my life. My father is not a person to sit still, right? Pre-COVID, post-COVID, right now, today, he's going to the store 5 times a day. He worked the polls, he's at Ace Hardware, he is moving. And I was scared to death about the risk of exposure for him. And as a result, I was afraid for my mom in terms of her potential risk of him exposing her. Scared to death. I don't think I took a good deep breath until they got their first dose of the Mrna vaccine. If Pfizer had been available, they would have gotten Pfizer. If Johnson & Johnson had been available first, they'd have gotten Johnson & Johnson, because I needed them protected. I know that the death rates for those that are 80 and older with COVID are extraordinarily high. And it wasn't a risk I was willing to take. Now that I can take a good deep breath and, the vaccine is more widely available, I can say from an experience standpoint that Pfizer and Moderna, it's a 2-shot series. So if it's hard for you to get off work or, get to wherever you need to get the vaccine, there is a convenience component. And we are seeing really low uptake in certain communities, probably because of barriers like that. There is also this, because it's 90, 95% effective, Pfizer and Moderna, we actually, stimulate your body, cause your body to produce more antibodies. And that typically means you'll feel a little bit more ill with the second dose of each of those than you might with Johnson & Johnson, right? My parents didn't have any symptoms. I got the Pfizer vaccine, and after my second dose, I had muscle aches, a little bit of a headache that, I treated with Tylenol, and I felt a little chilled, a little cold all day, the day after the vaccine, and it was gone by the day following. Okay. Less so with Johnson & Johnson. Folks are not getting quite, the level of symptoms. But remember, I said it's not quite as effective at preventing. So that probably means you're not producing quite as many antibodies as a result of that. I would say to anyone who is still on the fence, if there's one you should get, if you have a choice and your schedule limited or that sort of thing, I would say Johnson & Johnson. If you're high risk, you work in the retail industry, you're not working remotely, you have to be around people every day, you're touching surfaces other folks are touching, there's a lot of foot traffic where you work, which is the case for many people in our communities, right? There are a lot of folks who didn't get to go home, right? While everybody's talking about reopen the Florida economy, right? Some of us never went home. If you're high risk, then I would say take the vaccine that is available to you, because what we want is for you to have the risk of severe disease be minimized as soon as we can get there. That's the goal.
And this is great. I'm enjoying the information that I'm getting, and I hope it's helping you. Dr. Wells, we have someone that asked a question. They said, should we get the vaccine if we've already had the virus? should we receive the vaccine if we've already had the virus? Can you elaborate on that a little, please?
Sure. Yeah, that's a great question, and I do hear that a lot. So here's the thing, when you are when you have an infection, so that when you get the virus that causes COVID, your body does make natural antibodies to it. You do get natural immunity. And now that we have been dealing with cases of COVID in our country since late February, we now learn, we know more than we did initially, and we have studied antibodies in folks who have had disease, right? And we know that your natural antibodies peak at about 90 days after you have the infection, and then they begin to decline. Okay. Now that we're more than a year in, we are seeing people get reinfected with COVID. Okay, remember what I told you, right? We're seeing the virus change. We're seeing new strains of the virus emerge. New York has its own strain. Think about all the disease spread that was happening in New York. California, a specific strain has been identified in California. There's one from the UK. There's one from South Africa. There's one from Brazil, right? The more it is transmitted from person to person, the more opportunity there is for the virus to change. So here we are now at this point, and what we know is that the natural immunity, your antibodies peak and then they decline. At the time at which it goes away completely and you're susceptible again, vulnerable again to severe illness, we're not certain of that yet. What we can be certain of is that the formulation of a vaccine that has the ability for your body to produce enough antibody to protect you, like we do have that available to us. So what is recommended, and the CDC says you can be vaccinated, at any point post-disease. When our vaccine supply was lower in the country, we would say wait 90 days because we know you're protected for at least those 90 days, and then get in line to be vaccinated behind folks who are higher risk because they haven't had the illness. It's one of those things. If I like to think about things based on my own risk and what are the consequences of being wrong. If we assume you're protected and you're not, then the consequence of that assumption could literally be either, significant illness, hospital stay at a minimum. Think about what that does to work and family and those things, or death. It's not a risk that I would suggest we take.
That's great. Thank you for that great answer. I appreciate that. I hope you guys are being blessed by this information. It's definitely helping me. There's another question that someone asked Dr. Wells. It says, if I get the COVID vaccine, should I get the flu shot as well?
So the good news is that flu season is almost over. It typically it goes through the end of April, and we've had a very quiet flu season, which I expected, but I predicted too late. One of the things as a public health physician I learned to do is watch what flu is doing in other countries and climates before it typically shows up in flu season here in our country. And because, other countries, Australia and others, had a very mild flu season, I suspected we would have a relatively quiet season. What I was worried about was folks getting flu and COVID at the same time and the impact that might have, on their lungs, on their overall health. And so we didn't see a lot of that. We didn't see a lot of flu. The general rule, though, is if you're going to get another vaccine, you wait 14 days. So if you get a COVID vaccine, wait 14 days before you get shingles or any other vaccine that your doctor might suggest that you have, and the same thing for flu. But we won't have to worry about flu here in another few weeks.
Wonderful. Thank you so very much. I hope that's answering your question. Again, ladies and gentlemen, this session tonight is really to educate us. And as a pastor, I don't have these answers, and I've brought a powerful woman of God that we trust with our life to come and answer these questions for us. So you can ask questions on chat, and we'll try to address those questions. Dr. Wells, I'm going to ask you another question because this is some of the information that we have received. It has been said that this particular vaccination, it actually changes people's DNA. And that's been a concern. We've heard things on YouTube and information. And so some people are concerned about that it actually changes your DNA. Can you address this particular matter for us?
Sure. And I've heard that a lot. I think that, it comes from a place where, we have tried to educate the community about how these vaccines are made. And the Pfizer and Moderna vaccines are what are called mRNA vaccines. Um, mRNA is it's a component of our genetic material, and basically it is vaccine technology that's being used simply to instruct our cells, not the DNA of our cells, but our cells, to make copies of a small portion of the proteins on the surface of the virus that causes COVID-19, in order that the body can see these copies of this pieces of the protein and make antibodies against it. So there are a number of different types of vaccines. There now these two are mRNA vaccines. There's live or attenuated or killed virus vaccines. So like the flu vaccine, you inactivate flu virus, right? Make it so that it can't cause the flu, but when you inject it, it makes your body recognize it, and you develop antibodies. There are adenovirus or viral vector vaccines, where we take a piece of a virus we know, like adenovirus, which is a virus that causes mild flu symptoms. You inactivate that type of virus, and you, again, put the little piece that you want the body to build antibodies to there, and present it to the body. That's what the Johnson & Johnson vaccine is. There are, many, many different types of vaccines. None of them have the ability to enter, bind with, change, affect, impact our DNA. None of them. It is a physical impossibility. What is happening, and we have to just acknowledge this, right? What's happening is that we, on a national stage, are watching the development of vaccines. And it is not a space where, that we have spent much time talking about, learning about, thinking about, right? I can tell you, I've got 4 kids. Y'all know I got 4 kids. They all had all their childhood immunizations and everything that was required for school and whatever they needed to go to college, right? I never sat in the office going, now, which one is this? And what kind of vaccine is that? And right, I was like, you say they need this one for school? Okay, right? What side effects should I look for? Those are the questions that I ask. The technology itself is not, it hasn't been at the forefront. And as a result, physicians have just done a terrible job over the course of years, because we hadn't had to, of explaining it. Like we've never introduced this. But first of all, viruses work like that. They inject their own genetic material into our cells. That's how you get sick from a virus to start with. And what we've done in science is just exploited that technology in order to build our own protection against it. And so there's some things I think that folks, they're always going to feel a little confusing, because it's virology. Like I'm not a virologist, so it may not be crystal clear, but I'm going to tell you that the things that begin to circulate are not founded or rooted in fact. They really are designed, I think, to continue to disrupt our trust in the clinical system. And and I call out the fact that those of us who have had our own children immunized, we didn't worry like this, and as a result, we were able to protect ourselves and our children from a number of vaccine preventable illnesses.
Wonderful. I tell you, this is awesome. You guys are asking some great questions, and I hope it's being a blessing to many as we are asking Dr. Wells these powerful questions, and it's definitely helping me. There's another question that someone asked Dr. Wells. How effective is the current vaccine against the new strains that are developing?
That's a great question. And if there's anything that, I'm losing sleep over these days, it is worry about emerging strains. So I can tell you a couple of things. As soon as the first few variant strains were identified, researchers began to test the vaccines against these strains so that they could be confident as to their effectiveness. Now, let me back up and say that while we have identified a number of strains, it is not those strains haven't sort of taken over yet, right? That's actually one of the reasons that we have to be really diligent about, our 3 W's: wearing your mask, watching your distance, and washing your hands. Because while we wait for the majority of the population to be vaccinated, we have to, continue to do what we can to keep transmission from occurring. So that research is underway, and the preliminary data released both by Pfizer and Moderna, indicates that it has similar effectiveness against those strains. Though they are, because they know we know, right? We know that these strains are going to continue to emerge. They are beginning to think about whether or not we'll need, a booster, let's say, at some point, depending on what strain we see in the community. For me, when I hear myself say that, what that means to me is stop spreading it, right? So that we can get our arms around what we are currently seeing in our communities and get protected against that, get the levels down so that they're not impacting us so significantly, and we won't need boosters and that sort of thing. We may get to the point where we need, it may be like an annual flu shot kind of thing, where we'll see an increase in cases once a year, let's say, and we need to have those that are most vulnerable be protected against that. But at this moment, where we are in terms of the vaccine available to us and the current strains that are present in our communities, I think we're safe. But we have to do our part to ensure that we stay there, because otherwise the trajectory is that we may not have the good tools that we need. The other thing that I have to point out at this point is our case rates are going up, right? One of the things that we at Florida Blue have been tracking is the mobility. So how much people are moving. And I'm going to tell you, in Northwest Florida, that area of the state has more movement of people, just than any other place of the state. And it has stayed, that's been consistent for the entire year. Something's happening in the Panhandle where, we haven't slowed down quite as much there as we have in other areas of the state. And over the last couple of weeks, mobility around the state has increased. And for the first time last week, mobility in every region of the state was higher than it was pre-pandemic. That means we're not doing what we're supposed to do in terms of reducing disease spread. And that gives me, anxiety about where we might be in terms of our cases. We had a 4% increase in cases last week, a 6% increase in those over 85. Like, we have to get a handle on this. There's an urgency to that I don't think people are feeling.
Wow. Thank you so very much. Some of you guys, I will not ask your question because while she's talking, she's answering some of the questions like how often will we need to be vaccinated in the future. I think she addressed that that question. There's another question, Dr. Kelli. What is your suggestion on how to choose a safe vaccine when you are sensitive to certain meds?
Right. So, if there's a place where there really is a necessary conversation, I think it's that. The Pfizer vaccine, which is the first one to be rolled out, got a lot of attention early on. I think in the UK, they vaccinated a few healthcare workers, and there were some severe allergic reactions. So let me say this, allergic reactions are not fun. And I'm not talking about you have hives. I'm talking about your throat swells, you stop breathing, right? I'm talking about severe allergic reactions. They are unpleasant, but they are manageable, right? If there's something that a hospital knows how to manage, it is a severe allergic reaction, okay? As they have gathered more information about that, while the research studies had thousands upon thousands of people in them, right? Now we have, we vaccinated in the state of Florida 2.8 million people, right?
Wow.
So we have a lot more data. And as that data has come in, what we found is if you have an allergy to certainly any component of the vaccine, right? In every vaccine, Johnson & Johnson, Mrna, Pfizer, all have a fact sheet and it has ingredients. When you go to get it, you'll have that information be provided to you. So if you're allergic to any component, then of course, you can't have that vaccine. But if you have an allergy to what we call an infused medicine, so a medicine that you don't take by mouth, that has to be given to you through a needle, so through an IV, if you've had an allergy to something like that, then that puts you at higher risk to having an allergy to either Pfizer or Moderna. Even then, if you report that, right, what they're going to do is say, you know what, we want you to come to a hospital site, a medical setting to have your vaccine. And I want to just compare this to something for you. Years ago, I had to have an iron infusion, and the insurance I had at the time would only pay for, it would pay for this drug and not this drug, right? Well, we need you to know, Dr. Wells, that this drug has a higher chance of causing an allergy in people. Studies have shown that it causes more allergies. Oh, well, okay, well, can I get the one that done? Well, no, you have to pay out of pocket for that. I was like, okay, well, we're going to try this one over here, right? So we managed that. I needed the medication. And the team that was overseeing my infusion, we managed, and I did fine. And I offer that as an example of how we in medicine solve problems like that. What I don't want to have happen, and hear me clearly, a decision not to be vaccinated against COVID-19 is a decision to remain vulnerable to this disease. It's not just a decision not to be vaccinated. It's a choice. It's a decision to remain susceptible, remain vulnerable to this illness. If that is your choice, then I want to be sure that you land there, understanding that anything we needed to put in place to make vaccines safe and tolerable for you could be done, right? And so I don't want you to sort of close the door at, well, I have allergies, I can't have it. We're not talking about, I have really bad hay fever, sinuses. We're not talking about that. And for the most part, we're not talking about food allergies unless you carry an EpiPen, like you have the injectable thing that your physician has prescribed, because when you get exposed to a certain thing, your throat swells and closes, right? Your heart stops. If that's you, then you need to be certain that you are you receive your immunization in a setting where that could be managed if it happened.
Thank you, Dr. Wells. I highly appreciate that. I have one more question that we're going to ask because we're getting short on our time, and you've been so gracious to us to give us your time, and we know that you're a very busy woman of God. This question comes from someone. He said, "Is the vaccine safe for a person that has lupus?" You may have already addressed that almost, but would you just elaborate for the sake of this particular person, please?
Yes, I'm actually pretty grateful for that question. Lupus is what's called an autoimmune disorder. And what that means is your immune system is a bit overactive. And it causes, various symptoms. It is among a group of conditions that are a result of an overactive immune system. Rheumatoid arthritis is another one. And so the importance of that question really is based upon what you know about yourself and how you've responded to other vaccines in the past. Okay. If when you get, my daughter has a juvenile rheumatoid arthritis. And when she's had vaccines for college, for instance, she just didn't feel well for a few days, right? And the joints where she has trouble were painful for a few days. And that's because her system produces really sort of overshoots on the immune response. Now, do I want to protect it against meningitis, which is a risk when you go away to college and live in the dorm? Yes, I did. So the way we managed that was we prepared, we scheduled it on a day, on a Friday. So we had the weekend to manage whatever symptoms that we had. Like, it can be done. Again, if you think about your risk and the risk to those in your household, then we can come to solutions. So it may be that that if you've had issues with immunizations in the past where it causes a little bit of a flare of symptoms, you get really fatigued or what have you, then you might find that something similar happens with Pfizer and Moderna, and that might be a reason maybe to choose a 1 dose over 2, right? That might be a reason, but it is not a reason not to be vaccinated.
Good. That's good. Thank you so very much. I think these are two questions that we would like to get an answer to. And so I'm going to ask two more questions. And so y'all just bear with us. Um, Dr. Kelly, do you still feel that there is a need to wear masks and stay 6 feet apart after getting vaccinated?
So, I think there's some good news on the horizon. There's the CDC released something a couple of weeks ago now, what you can do once you've been vaccinated. And essentially what they said is that if you've been vaccinated and and completely vaccinated means I'm 14 days past my final dose, right? So for Pfizer and Moderna, that's 2 doses, and for Johnson & Johnson, it's 1 dose. 14 days later, you are protected. If you've been fully vaccinated, you can be indoors with those others who are fully vaccinated without a mask. Okay. If you are fully vaccinated, you can interact with others from one other household who are unvaccinated, right? Without a mask. That's the newest guidance. And now, we're going to send some materials. I think I've shared some things that we've put together that I think you'll find useful. And I will send the link to this particular, these recommendations. Now, we'd originally said to folks, you have to keep wearing your mask because you may still carry the virus in your nose, even after you're vaccinated. But again, the value of really staying in the data and watching what the emerging research is showing us, we're finding that they're really not keeping as much virus in your nose as was initially thought. And so the risk of you spreading that to other people is actually quite low. And so I think that we'll find that in certain controlled settings, we won't need to be masked to be together. I'm planning, to rewrite our guidance at Florida Blue so that our employees, when we bring them back into our buildings, we will probably modify some of the guidance. Now we require masks, no matter what. As everybody comes back on campus and they're vaccinated, we may be able to really relax some of those things, and the masking is probably the first thing we would modify. I think we'll probably still keep the hand washing and the increased hygiene, but I think we will be able to get closer, and we will be able to pull our masks off.
Awesome. Wow. Great answer. One more question, Dr. Wells. There are some people taking vitamin C and D during this time. Should they continue to take vitamin C and D throughout the year for more protection from COVID-19 after being vaccinated?
I'm proud of y'all. Y'all are my people. Y'all are smart. So here's the thing. Okay, vitamin D is it's produced in the skin as a result of sun exposure. And because of how that vitamin is produced and made available to our bodies, people of color, so people with more melanin in their skin, tend to be higher risk for vitamin D deficiency. Okay. So some of you may have been to your doctor and been told your vitamin D was low and you have to take this many units for this many weeks or whatever to try to restore your vitamin D level to normal. Here's the reason that matters. Vitamin D deficiency actually has been shown to be connected to the huge inflammatory impact that COVID has. So one of the hallmarks of bad COVID infection is this huge inflammatory response that causes blood clots and destruction of tissue and a lot of mucus and other inflammatory factors that are created in your lungs and make it difficult for you to breathe. And there is a correlation. There is a relationship between vitamin D deficiency and that terrible inflammatory response. So the recommendation is that we try to normalize your vitamin D. Vitamin C itself has anti-inflammatory components. Okay. I'm not huge on vitamins because you should get it from your diet. Like, I want you to eat better rather than rely on, like, I don't want you to eat the Big Mac and then take a multivitamin and feel like you're doing something, right? Because, right,
That's
because
right.
there are other things that are necessary that we can consume, and most of what we need is present in our diet and can be consumed in adequate amounts. That said, extra vitamin C isn't going to hurt you. Like, if you take too much, your kidneys sort of, move it out of your body. And so I don't think there's any harm. Folks ask me the same thing about zinc. Um, you know, there's no harm in that. And there are a few hospitals around the state that use a protocol that includes vitamin C, and steroids, and a certain antibiotic as a part of their cocktail for treatment of COVID. So, no harm, no foul if you're taking it. If you are deficient in vitamin D, right? So some of you out there are like, I think my doctor might have said something and I stopped taking that pill because it didn't make me feel no different, right? Circle back to that. Okay. I know some of you out there are doing that. That is the one thing that has been correlated with risk, and that may explain the additional risk for people of color with COVID.
Wow. Thank you so much, Dr. Wells. You've been such a blessing to us tonight, and I know that our people are just thrilled. We're looking at maybe having a part two. We know that we need to get all the information that we possibly can about COVID-19 and the vaccines. Dr. Wells, the last thing, if you had one more thing that you can share, you've been spending time asking questions, answering questions for us tonight. Um, is there something that we may not have asked you that you need to share with us? Can you just take a few minutes to just say what's on your heart, if there is something at this particular time that we may not have addressed that we do need to hear?
Absolutely. I've spent my entire career um, addressing health disparities. And what disparities means is one segment of the population has a higher burden of illness or disease than others. The way to get to equity, the way to ensure that we are not at greater risk, it has a lot of factors, right? So part of that is ensuring that you got access to what you need. Can you get access to care, treatment, vaccine, testing, et cetera? The other thing is to be sure you have access to the right information. And so I would say, check your sources, right? You cannot get everything from social media and believe it, right? And use your resources. I completely understand that, you may not want to, believe what comes from a physician with whom you don't have a relationship. Maybe you have a physician and don't have the kind of relationship you should have with your own doctor. Whatever the situation is, you've got me, and there are other physicians in that community, in our community, that are advancing the right information. But you need to look around, find your resources, and be sure that you are creating an opportunity like the one that our bishop has presented to us tonight, for you to get your questions answered completely and thoroughly. The other thing that we need to recognize is nobody's coming to help us, right? This is our thing to do. And my concern, while disparities and equity has gotten all this attention, and we have this data now about how Blacks are 3 times as likely to be hospitalized with COVID than are whites, and Latinos and Hispanics are 4 or 5 times in some cases as likely to be hospitalized. All these things are beginning to circulate, right? What did we do with that information? How did we shift our behavior? Here's what's going to happen. We will move to reopen, right, and get back to normal. And based on what I know now with the vaccines, I said, 2.8 million or so have been vaccinated in our state. But the number of Blacks that have been vaccinated versus the number of whites, it's incredibly lower. It's much lower. And so the majority community will be protected. They will have vaccine, and folks are going to be going on about their business. And the Black community and other communities of color will remain at risk. And it won't be making headlines anymore. Okay, it's not going to be, the lead in for the 6 o'clock news, as have other health disparities that have existed for years. Diabetics, infant mortality, pregnancy complications that plague our community at higher rates than others. Right? When this conversation ends, we will be the ones still left at risk, and we will have lost mothers, fathers, aunts, sisters, brothers, and our community will have more to recover from. So I understand being fearful. I understand being cautious. I understand, you not feeling like you have the information that you need. But I'm charging each of you as the caretakers of your own health to do what is necessary to get the information that you need so that you can confidently protect yourself and your loved ones from this infection.
My God, thank you, Dr. Wells. This is such a blessing. We appreciate you taking out your valuable time. Listen, people of God, I believe that we've heard revelation from the Lord. God has equipped this woman of God to get the information, and she shared with us in great detail on tonight. And we want to thank you. Again, people are destroyed. God's people are destroyed for the lack of knowledge. And because we reject knowledge, oftentimes we reject God. God is found in the knowledge. All right. God is found in the knowledge. And so he gives people knowledge to bring to us that we may make godly decisions, wise decisions. All right. And so I hope tonight that after getting the information that you have received on tonight, that you would pray about it. No one is making you do anything. No one is suggesting strongly. You got to be persuaded by your own mind. And so I'm just praying that in the midst of us presenting knowledge to you tonight, you got enough information to make a wise decision for yourself and hear God in the information. All right. Thank you once again, Dr. Kelli Wells, and we appreciate you so very much. There will be a part 2 that is coming, and we'll be able to share more. We know that some of you may need to hear this a few more times to convince you. However, we're willing to do whatever we need to do to get you the information that you need. I want to pray for you tonight. All right. I want to pray for you tonight. And if you would just come with me and let's just come together in our minds and in our hearts and let's pray for our community. Amen. Let's pray against this pandemic, and let's pray that God would give us the wisdom that we need to get the healing that we need. Father, in the name of Jesus, we come before your throne tonight because we recognize we need you more than we need anything else. God, tonight, we just thank you for life, health, and strength. We thank you for the abilities that you have given us. God, we thank you for Dr. Kelli Wells coming to us tonight and sharing wisdom, knowledge, and understanding concerning COVID-19. This virus has devastated the world. And here it is, God, you have given us an answer to what to do and how to do. And so, God, I pray tonight that those that have listened in great detail, they will make wise decisions. We don't want the world to move on, and we're still stuck in 2020. Help us tonight to be wise. Help us tonight. Give us clarity. Even if we're not sure, even more, let us come before you and you speak to our hearts and speak to our minds. We thank you for loving us as our Father. We thank you for loving us as our God. We thank you for tonight. In Jesus' mighty name, amen. Well, God bless you on tonight. Thank you so very much for tuning in, and share this with others, okay? Share this with others. Tell them if they missed tonight, it is a must that they go back and check out Ask the Doctor. And I know it will be a blessing in their life. Well, God bless you. Thank you for this hour. You enjoy the rest of your evening. God bless you.